So hello everyone. It's a great evening. Thank you so much, guys, for joining. I really do appreciate. And I'm sorry, I was just trying to share my video. I think I have an internet challenge, but I think we'll just continue from there. And thank you so much, guys, for joining. I know it's still early for most of us, and unfortunately, some of us are not able to join, maybe due to they still have ongoing classes. But the good thing is that we are recording the session, so they should be able maybe to listen in afterwards. Otherwise, thanks so much for joining in at this hour. And I would love to welcome our guest speaker today, that is Dr. Hyfa Ali. And the reason I shared for the video, maybe she can attribute. She has been the one who has been in charge of the antibiotic smart project, which is a very novel project. And I went attended that webinar. It was very it's a very novel approach and a very great way of engaging the community. So I'll introduce Dr. Hyfa, then I'll hand over to her to take us through the session. So Dr. Hyfa Ali works as a public health consultant for React Asia Pacific, and she supports the Antibiotic Smart Community Project and student engagement programs at the ASPIC clubs. She has a training in dentistry. She's a dental surgeon and enthusiastically picked public health as her field of work. And in 2019, she earned a master's degree in public health and began working as a community engagement officer for palliative care organization. And she has also worked temporarily as a healthcare researcher on equity focus project. I met Dr. Hyfa last day in person, and I can say she was very optimistic and very supportive. So thank you so much, Dr. Hyfa, for joining us today. It's a great pleasure to have you with us and to take us through what you prepared for us today. Thanks so much and welcome to the session. Over to you.
Thank you so much, Daniel, for the warm introduction. Just like how you have mentioned, in India, we do have certain trouble with internet issue when it rains. So for the interest of connectivity, I will just turn off my screen and I'll start sharing my presentation. So I would be briefly touching upon about, like, I have been requested by Daniel to share a bit regarding applying systems thinking in developing impactful and sustainable AMR interventions. But then I would like to just slightly, point out this fact that I'm more of a less theory person. I have been practicing systems thinking in my project. That was just that a small glimpse that you have seen just a while ago. But more than that, the theoretical side, I would say I'm a little bit weak. But then I can just briefly point out a few things that I have learned over the past 2 years working with React as a consultant. So assuming that all of you have a brief idea, you have been already introduced the concept of antimicrobial resistance. I'm not touching upon that part, but I would like to walk you through this larger picture of AMR as a global health issue in the community, within the health system. So I would be focusing more on that part. All right. Yeah. So at any point, if you have any question, please feel free to share it in the chat room, or maybe even if we have a little bit time towards the end, I'm very sure we will be having some time to have a good interaction later on. So please feel free to join in anytime you have something to share or ask. So I look forward to a very interactive session. All right. Yeah. So like, just to start with, so I would rather prefer to have like a bit of informal session. Okay, so anytime you have a question, please feel raise your hand or come to the chat room. All right. Yeah. So basically, when you talk about systems thinking, I would like to know, like, it's like a holistic approach that you're taking forward. You're not taking component by component, rather you're trying to see the larger picture of it and how each component within that interacts with each other and then adapt, and then you get an output from that. All right. So, so basically, through this approach, we just understand how things organize within it and how the society work towards the collective goals, and how each, component, like each component of the system actually acts and contributes to an outcome. So basically, you practice system thinking. This includes multiple perspectives and synthesis of like within a framework or a model. And this was initially introduced by Bertland Field, 1960s, this concept. He actually came up with a meta theory of like multiple components work together and then they come up with a result. All right. So that was like a brief part of like how system means. You have this larger system. Each system has multiple small components with it, which interact, adapt, and then work towards a common outcome. All right. So when we say systems thinking, what is actually a system? It can be anything. Okay, a system can be like a connection or an interaction of parts and how they are connected to each other and how they come together for a purpose. Like for all of you, I have been told already that all of you are like tertiary care. I mean, students who have some exposure to medical background. So health system is like a classic example. But then when we speak about health system, it's not just about healthcare delivery. It has a larger picture. It has the public health component to it. It has multiple factors, the policies that affect health system that comes into it. So all this have to be a component of your systems thinking. So it's not just about one particular domain, right? It's about a larger perspective that you're seeing. You're seeing a holistic approach about how you have to act and where you have to act to make the difference, right? So then there are like, it's basically how you define. It's like you remove one part of it, the system actually ceases to function. So like certain characteristics that a system would be having. One is like it will be dynamic. It keeps on changing. It keeps on evolving all the time. And these components within the system could be like interconnected. So you remove one, it might stop working. You enhance one, like for example, you give more finance to health system, you would have a more productive health system. Or you recruit more staff into the health system, you will see a difference where you would have an improved efficacy in the functioning of the system. So it's more about like all these things could be interconnected. And then besides, there is also like a boundary for the system. Like there would be something that delineates the system from the other part. All right. So all the system would have one or the other boundaries. Like healthcare system is limited to those components within the health system. And then when we talk about it, we're talking about the interactions within those individual components. So that's about health system and or that's about like systems thinking as such, and then a system what it is. So this understanding this terminology is like really important when we move forward, like about larger picture of the health system and systems thinking. All right. So basically a system can be a simple system, like one single answer, a single thing. Like for example, you talk about your hand, or you talk about a bacteria. All right. It's just one single system as such. But then bacteria interacting with environment alone, it's like you're having multiple parts to single answer. All right. So you can have multiple pathway to it, but then there is like one single answer to it. Then there comes complex system where bacteria interacts with environment and human and multiple. And then one classic example, AMR, it's a complex system. We have multiple pathways, multiple causes to AMR, multiple solutions to AMR. And it also stems from the same idea where problems to these systems, how do we address the systems? It can be also similarly like that. It can be just well-structured problem with one issue. It has a proper one solution, or it can be like one issue with multiple solutions. It can be multiple issues forming an issue, and then it can have multiple solutions. So just understanding that when you have a systems thinking approach, you mostly deal with these kind of complex systems. So these complex adaptive systems where multiple issues are there, you are going to deal with multiple things in it. Like, for example, one classic issue that you might be familiar is like low birth weight in children. So in public health, all the issues are like complex issues. Mostly, like it cannot be like just one thing and one particular component interacting with only one issue. It has to be multiple determinants that affect public health issues, and that requires multiple solutions from multiple perspectives. So this is like one example where let's just consider the issue of like malnutrition issue or low birth weight. All right. So how is it affected? All of you might be like familiar with the vicious cycle of malnutrition, where you have a low birth weight baby. And over the years, due to multiple factors like poor weaning or lack of proper food, healthcare or anything, the child is stunted. and the child is again not receiving adequate food. So it leads to standard adolescence, and the adolescent women getting pregnant. So basically she has like a malnourished pregnancy, and she giving again birth to a low birth rate baby. So now that we come to it, it's again a malnourished women going into elderly and then reduced capacity to care for the baby. So in either way, see, these are like multiple ways you're seeing the same issue. And this can be due to not just the issue of health system, it's a developmental issue here. This is again an issue of culture, where in any household, men would have more preference on women when it comes to having food. So when we think about solving an issue related to antimicrobial resistance, especially when we're dealing with the community, we should have this wider perspective. We should try to see this multiple developmental issues or cultural issues, gender, which is like a very major impact. Or let's say environment could also even play a role, where crop failure or perennial scarcity of water leading to poor crop production. All this could lead to a stunted or a malnourished adolescent in the women again. This further leading to low birth weight. So these are like multiple pathways causing multiple issues at multiple stages of life. All right. And all this, like in and out, the solutions are also like different. It can be giving a proper stable source of income, rehabilitating the women, interventions at multiple stages. It can be interventions while the child is in school, or it can be in the adolescence, or even pregnancy. That time the weight corrections and enough measures can be taken out to solve the issue of, low birth weight. So all these things have multiple solutions, and that is why public health issue requires a systems thinking approach. All right. So now we know AMR. So AMR is often like we project AMR as a One Health issue. All right. So when we say AMR as a One Health issue, we're just describing a very complex system here. Being mentioning it here, it's not just about usage of medicines. It's about it's not just about government not giving enough priority, or it's not just about lack of adequate wash practice in the area, or even it's not just about it. It's all about these multiple issues that triggers or accelerates or work upon it. Like, how do we see that? Like, for example, in case of its environment or climate, let's say, very least, the recent years have seen this interest in environment and climate issues related to AMR. So we say desertification or reduction of biodiversity, environmental pollution, of course, wash practices, poor wash practices in households as well as healthcare facilities. Then it can be even the sudden change in climate and a result of that, any environmental disasters. Yeah, or even increase in population is also one reason that could cause AMR. Excuse me. So again, let's speak about animals. Like we know animal consumption, intensive animal husbandry practices could be another trigger for AMR. It can be even uncontrolled wildlife trades in LMIC context mostly, or destruction of natural habitats and zoonotic diseases. We see, like, for example, a simple COVID is like a classic example where a zoonotic disease could accelerate antibiotic use throughout the world. And we definitely have seen an increased use of antibiotic sale or increased sale of antibiotics across the world. Another issue, like let's come to issues of people and society pertaining to it. When we have social inequality, malnutrition, or rapid urbanization, and as a result of poor sanitation and living conditions, conflicts, war, migrations, refugee crisis, then there are certain aspects related to culture and human behavior where we triggers AMR. Like, for example, I am from India. So in India, there are practices related to farming, which might not be very environment friendly, or there can be like aspects where people, certain people wouldn't take a treatment on time because of religious aspect. They would be relying on alternative practices, and then that would also be another cause. So all these things, like access to education, that is also having a lot to do with the society and the culture that we represent. So it's again a multi-sectoral issue. When it comes to governance sector, which is like where we look upon a lot for our solutions, rather than we we always try to like look up at the governance for a solution rather than we don't look down at the communities for solutions. So here, health system and how it is, like over-the-counter sale of antibiotics or poor regulation of antibiotic sales that happens in almost all the regions in LMICs. Poor professional training, where poor prescription practices is another reason can be, and use of and like regional research methodologies or approaches, lack of preventive aspect rather than focusing on curative. We sometimes ignore the preventive side. Again, the health system might not be competent enough to deal with multiple outbreaks or issues happening. So all these things, poor diagnostic capacities, all this could be a reason for increased AMR. So this, it's a larger picture. You cannot, like working on one particular issue wouldn't actually give you a solution. So when you come up with a solution, with a program or an approach in mitigating AMR, it can be focusing on one of these issues, but then these underlying issues should also be under consideration, or it should be also prioritized when you coming up for a program, especially if you're trying to work or looking forward to work in the community level. So there are multiple, like you would see any number of approaches and tools and system to me. So speaking about one particular tool or one particular approach wouldn't just justify it. So but then these are like very commonly, like these ideologies or these approaches are like very often necessary to understand systems thinking. So one is like interconnectedness. So here we know this approach where it's not just one mechanical straight issue that you're dealing with in public health. You cannot be like, you're giving medicine, people eating medicine, the disease, it's getting cured and yes, done. No, it's more of a circular. People eating the medicine, if they are, if their defecation or the or if they're not completing the course, if they're throwing out into the environment, or if their wash practices are poor, all this could lead to again AMR. So you should see more of it as a circular, non-linear approach. So that is like one thing. So all these things are like chaotic, interconnected relationship, and then there would be loops and interloops that are all happening in them. Okay. Second thing is like synthesis. Here, where this ideology is coming, where like if there are like two or more things that are like, they combine together to form something new. So it can be opposing or it can be like together. Like synthesis about understanding the whole and the parts at the same time, where all these small components within it, there you're seeing the interconnectedness, like two components coming together and synergistically creating something or coming up with something new. Right. So it's just about understanding the connections between individual contexts. Right. So emergence, then it is the natural outcome of things coming together. Emergence is like the synergies of parts. It's again about self-organizing yourself, and you describe the outcome. Like you interact together, you come up with a solution, and this is like two synergistic action leading to something else. Okay, so this is again a part of design thinking. Then causality. This is like this could be the cause. Understanding multiple cause leads to a feedback or a connection or a relationship. So basically, this can be interconnected and synergistic, and can emerge to create an outcome. And there are like multiple causes behind the system thinking approaches. All right, so this is like in brief how we could describe this. Yeah. So most often we represent this approach feedback loops. Like one tool that we use is like, I have told you already, it's not a straight cut path that you have when we speak about AMR. So in this particular loop, we're just trying to show an AMR system map. Okay, I'll share the link to this article so that you can have a good read later on in detail. So feedback loops are like basically on the idea that all these things are interconnected in one way or the other. So this can be like, like suppose we have issues like policies or environment or treatment method, which is like way different from biodiversity or available resources or antimicrobial usage. Okay. So, and again, like treatment of wastewater or transportation network are like different things. Right? So all these things are some way or the other, like adding on to it or, related to it to create an AMR mitigation approach or a change. All right. So like it can be positive, it can be negative. Like for example, you have antimicrobial usage. There would be an increased antimicrobial usage when there is an infection. Okay. Again, if there is like infection also leads to death. And antimicrobial resistance, again, it can also lead to death. So when there is an antimicrobial resistance, there is again an antimicrobial. It's just you have to picture it yourself. Like I would suggest, like when you have time, like sit down and connect yourself with these issues. Like connect yourself with these multiple issues that you see around you that is like causative to AMR, and you would understand that. So on the external side, you have factors like policies. When you have a stronger policy, there would be reduced antimicrobial use. When you have reduced use, there is again reduced AMR. On the other side, when you have a stricter policies to manage the demand for food security, there would be better health. There wouldn't be malnutrition. So without malnutrition, obviously you're bringing down the infection. So it's just the loop that you have to understand. You have to understand these determinants are not just linearly connected, but there is a loop, and this loop can be positive or negative. So suppose you don't have a proper political will in your country. When you don't have a political will, you wouldn't be having a proper, or let it be a corrupted governance is there. There would be food scarcity, or there wouldn't be adequate policies to control or adequate development in the healthcare system. So all this could again lead to AMR. You would be having increased AMR, which leads to increased death or again high healthcare expenditures. All this would affect it. So it's about you understanding it. So the loops can be interconnected. It can be like a positive loops, like a balanced loop where one change leading to the other, or it can be even like one loop can continually refine itself and like keep it circulating within that. So it's about balancing the thing out when it's about feedback loops. Okay. So you're just figuring it out how these are interconnected in the positive way or in the negative way, and identifying multiple stakeholders within that or multiple determinants that leads to it, and figuring out as a loop. So that is like one approach that we adopt in this. All right. Then systems mapping is like again another tool that we use, like multiple ways of like highlighting. So there are like various approaches within that itself. Like the loop diagram again comes in the mapping. An iceberg model is yet another thing which I would just explain a little bit later. Again, another thing would be like all this mapping about key participants. Like for example, connected circles. This you might be even familiar when you have done any kind of like interviews where like how A, B, C and all like within the circle, how they discuss each other or how they connect and how there is a flow of information or how there is a flow of ideas within it. All these things can be. It's more of like representative approach. It's about systems thinking. One thing I would love to like to highlight at this point is like it's about you practicing it, understanding it, and try to make it a part of your everyday activity or approaches that you have. And it's not just limited to health system. It's applicable to any domain that you are in. This larger system thinking approach works. So I've just told you about iceberg model. For diseases, we have always seen that we often see the tip of the iceberg. Rather, there are so many events or so many causalities that that's associated with the bottom part of it. All right. So here you can just see that though there are like so many things which happening which should be prioritized, but is given towards them, like mental notes and all. Right? Then there is like stocks and flow, where there would be like a stock and a flow, and that would be just connecting to it. Like for example, there's the feedback between how went and how it changes over time. So it's again another approach of system mapping. So it's just in case of AMR, like as an example of iceberg issue. So like let's say the event is like resistance of antimicrobial resistance is like it's a It's a threat to human. It's one of the biggest global health issue that we have. So how do we have these issues? What are the trends over the time? There has been an increased use of antibiotics. There has been a demand for there has been globalization has led to like change in travel and animal and food. There has been transition of people. There has been growth of population. And there is an increased inequity in multiple array, including wash or the access to food. So all these things. So this is what we see. When we look at it, AMR as an issue, and these are the things that we observe. So beyond that, what could be the factors that are leading to it? It can be multiple issues, like increased use of agriculture, like intensified agriculture leading to animal infection, or there is a higher demand for meat, and that is again pressurizing the existing food system. Or then there is like prolonged stay in the hospitals, or like spread of bacteria due to poor wash practices, like open sewages. Then, but then people having access to medical system could be like on the good side of it. Then again, there could be like lobbyism by the pharmaceuticals and multiple issues could be. So these are not essentially visible when you look at it at one go, but this is like something that comes in the second layer. And then what assumptions, what could be like the values that people hold about the system, or how it's like kept in place. So people do have this certain notion within them that, okay, if I go to the doctor, I would feel better. Or the doctor's belief is like to be on the safe side, because they would be prescribing medications or anything. Then there are people who still believes that, like how people used to believe 20 years ago that climate change is a scam, and still there are people who believe it. AMR is also like there are people who believes that this is not a real issue. It's not something which requires a lot of attention. So this perception, this mental beliefs that people have within them. And again, this people's belief of like culturally, there are people who restrain themselves from taking medications or modern medicines. Then there are like numerous other like the practices, agricultural practices, which leads to antibiotic use. Or then again, like we see how these price levels and healthcare habits and so many issues, like people's knowledge about antibiotic use, or not like sharing of medications within the family. There are multiple practices and beliefs within them. That could also be an issue for the iceberg. So when we just see AMR as a global health issue, that is like the larger framework. So let's just cut it down into smaller pieces and understand how these things work together as a larger system. So that is about understanding these what is beneath the water, just like how we have the diseases, tip of iceberg, the symptom. So now this is like a very tricky question. But once you have like done your system mapping, when it comes to analysis, do we know at which point do we have to like, where do we have to actually, note it down? Where do we have to actually put the intervention or change should be created? So if one person would actually know this, like one point would be there, where if you create some amount of change, there would be like a larger impact. Okay, so such a point is called a leverage point. So this is just a terminology, but rather we have to identify tasks. So in one of the literature that I've read, where they say that like in case of AMR, it can be like infection and malnutrition could be one area. If we could address the issue of malnutrition, there would be lesser infections. There wouldn't be cases like diarrhea or under-5 deaths could be like prevented or reduced. And again, the issue of intensified animal production, if we could find more of like a sustainable way of agricultural practice within all the contexts, be small backyard farmers to larger manufacturing units. A healthy, sustainable approaches in animal husbandry could be another reason that can be. And utilization, making resources available. Like not all the countries would have capacities and strength to address AMR as an issue. So at which point do we have to show this, where do we have to like keep the change? Where do we have to have this point that we should have the intervention? So that's such a point we can term it as leverage point. Okay, so it is this point that, or I don't know how much it would be easy when you work on the ground practically, but technically it is about these leverage points that we should be like identifying it, identify where the changes have to happen, and then we could figure out how it should be addressed. So when Daniel just began this presentation, today's session, there was a small video which is played. So that is about a project that I have worked for the past 2 years along with my team in React Asia Pacific. I basically work on community engagement, and the project is called Antibiotic Smart Community Project. So in the project, I am trying to we were trying to work on a 11,000 strong population village in the state of Kerala, India, where I'm hailing from. We were trying to develop healthy practices and trying to develop a smarter community. So we adopted multiple techniques. So like, for example, stakeholder mapping. That has a component where we identified who could be the stakeholders that can be useful for our approach in developing a smarter community. This includes approaches to communicate with local self-government, approaches in handling self-help groups, measures to include health system, the existing medical fraternity working in the village. In India, we have alternate medicine in addition to, modern medicine. So how about bringing about all these people on one go, having the veterinary system and veterinary surgeon on board. So these multiple approaches we have done. And we tried to develop this, we created an indicator framework, a framework of like about 15 indicators that have multiple factors in it. Like the indicators vary from human sector. Like, for example, what is the proportion of under 5 children who had vaccination in the village, like BCG, Hepa B, and all, and measles and rubella. And then the next would be like how many pharmacies in the village actually gives out over-the-counter medicine without prescription, antibiotics without prescription. Another example is like how many, does the healthcare facilities have a protocol for antibiotic use? So these indicators vary. So that is pertaining to human health. Now, when it comes to environment, we had factors like, do the farms actually throw out effluents into the nearby water bodies? Or does the household have proper waste disposal system present? Okay. So, for example, if the schools have running water and gender-specific latrines within the community. So based on that, we have multiple small, criteria for scoring. So if all the schools in the area have like proper running water, then the score would be like 3. And if any school doesn't have, it will be 2. And if less than 50%, then it's 1. So like that, each indicator would be having small cutoffs. And based on that, we would be scoring. So we have total 15 indicators. And based on that, we should be getting a maximum score of 45 and a minimum score of 50. So the current community that we worked in had a score of 34. So our aim was to improve the score of 34 by focusing on some activities. Okay, so we would like to call these activities action agenda. So this action agenda was framed based on the scores that we obtained, like how I have mentioned. So if the indicator has a score of like 3, we wouldn't be touching it because the community is well and good. If the indicator score is below 3, or if it's like 2 or 1, there is a focus or there is a scope for improvement there. And we would be tailoring or contextualizing activity for that. All right. So here the action agenda would be like directly we are focusing on this. It's like positively we want to influence a score, specific indicators. So our activity should have this component of like ideology where after we conduct the activities, we should see if there is a change in the community. All right. So we had this community engagement approach where we had this multiple dialogues and discussions with community members. whom we have already marked or earlier itself over the past few years when we were working. So so basically the agenda for determining action agenda was like, first is like, do we have the resources? We do have constraints. We can't be spending so much money. We can't spend so much energy on one particular activity or agenda. Second thing was like, does the community need such an intervention? Are they interested in taking up it? See, ultimately, it's about them who should take up these interventions. They should accept these interventions. All right. So next thing is like, it has to come up from the grassroots level. It should have this multiple collaborations and ideologies that should open up, and that should be like from the grassroots level, the change has to happen. And then it has to have this, in order to have this sustainability approach, like it should not be just a one-time thing. Like, for example, we see issues of like malaria, malarial interventions in most of the countries. It relies a lot on supply of insecticides treated bed nests. So we see that people supply bed nests and during the project tenure, and it's an insecticide treated bed nests, and people would be using it. So once the project is over, there might not be a sustainability component there. Like the people might change their behavior, people might the insecticide might need reapplication. So along with that, these kind of projects could also hamper the existing seller in the area, for example. So for example, if there was a seller who was selling bed nets, but then you're getting it for free, he wouldn't be having any trade. So naturally, he would close down his business. So later on a period, when you need a bed nets, it wouldn't be easily available to community. So like those kind of small sustainable changes that we look forward for. Like, so we wanted to make sure that the local self-government or the community members would take it forward to the next level. So this was like the ideology behind or the points that we considered when we decided the final action agenda. So we came up with a set of 12 action agendas, and these agendas varied from, like for example, for the school students, we demonstrated how to make soaps, okay, how to make hand wash and soap from locally available, sustainable, cheap products. They wouldn't have to spend so much money in the school. And this was more of like an activity which they could embed it into their science club activity. They could come up with multiple flavors, or they could come up with herbal hand wash or anything, any idea they can just generate from that. So this was like one example. Another example was like we supplied small packets of like vegetable seeds to the community, and the community members could just start off with sustainable, like small backyard farming as like a token. We gave them a larger lecture of how to have this kind of backyard farms with sustainable agriculture practices. And as an initiation point, we supplied, vegetable seeds and grow bags. Another example, which I have included here, is like training for demonstration for the construction of sockage pit and compost pit. So here in this case, we had observed that certain low-lying areas in the communities, they did not have sockage pit. And there is this huge disparity that you observe between within the community itself. Like within one community, it would not be a uniform community. There is this multiple set of people within it. Their demands are like different. Like, for example, there are elderly people whose demand is different, and that wouldn't be what a middle-aged person who's working would be having. Again, there are people from socioeconomic background. When they are from a well-off socioeconomic background, they would be having a very different set of interest when it comes to an action agenda. So it was more of like a trade-off. So in the community that we were working in, we have got this program called like employment guarantee scheme. Okay, so it's a nationalized program which they say like Mahatma Gandhi scheme. So it's there throughout India, where every household could get like a small amount and a guaranteed job. If it's a rural household, they would be getting a minimum payment and 100 days of employment for these kind of labor activities. All right. So that is like one thing. And then we have this local self-government, which is very strong. that they have independence charge. They have power to finance and allocate money. Then we have this women self-help groups, which is like very active in the state of Kerala. Like across all the villages in Kerala, you see this one component called Kudumbasri. So it's about me understanding the system there. Okay, so all these are like stakeholders of the larger system, right? So when we wanted to develop an approach to have a wash intervention there, the first thing we came across was like, we cross-checked with the government programs that is like related to wash. So we came to know that the government has a scheme of providing around $100 for the construction of soakage pit. And this is in line with the scheme, employment guarantee scheme. So the people involved in employment guarantee scheme would be taking up this hard labor jobs. Okay, so what we did was, as a catalyst organization, we offered to train them. We offered them free training where they would be demonstrated how a sockage pit can be constructed, how a compost pit can be constructed over a period of like 2 or 3 days, where they could have like literally stand there and watch it, and construction can be learned, and they can reapply it again in the community. So this was like local self-government actually allowed us to conduct the training on behalf of them. There was this Department of Employment Rural Guarantee Scheme that provided a trainer for us. We gave them materials, resources, refreshments, and a spot to do all the training facilities. So this is how we can see, rather than having small independent project, rather we try to be a part of the system. We try to do this intervention like that. So as a result, over the period, like we have a sanction for 60 sockage pits in the village. So that means there will be 60 sockage pits guaranteed, will be definitely constructed through these trained women. So they are getting a source of income. They're getting an additional income for what they're doing. And the better part is like, these sanctions could be even allocated to these women as they belong to lower socioeconomic category. So it's like a larger picture when you look at it. They're getting income. They are getting a sockage pit constructed in their area. So for us, when we look at the larger picture, we are trying to mitigate or improve the wash practice in the area. So yeah, this is like one example where you can like on the ground how a systems thinking approach can be like practiced. It will not be very difficult. Just understand like this kind of sustainability or approaches that we want to have. They require a little bit of knowing the context, understand what is required in the community, if they actually need it or not. That's like the most important thing. And second thing, if they are not aware of what is the right thing that they should be doing, it's about creating sensitization. And then there should be a stronger political will, where we saw local self-government was very supportive of all the activities that we were doing. So for that, again, over the like past year, in 2018, we tried to create this awareness among small local government. So they aided in our Future Act so that we wouldn't be having issues later. Then there should be sustainable funding. So in this case, we were getting money from multiple sources, and the training was facilitated through React. Then contextualization. This particular community required sockage pit, and they wanted to learn it. And they were having a set of women volunteers who wanted to develop their skill and thereby improve their source of income. Then understanding the culture. So culturally, it depends again. If they would, if it's not something that would be offending the people, or if it's not hurting. Then identifying the resources. We marked down, like for example, the resource person. We figured out the resource person by having a proper community person and interacting with the community as well as local stakeholders. So all these things are like few factors, but these are not the only factors. There are multiple factors that requires you to have a sustainable approach. But then systems thinking, developing a systems thinking is something which is vital in having a sustainable program, or actually have a difference, The same is applicable for you developing an ideal communication strategy. It has to be taken up by the community. There is like a point where you should know you should know what is the context there. And for that, you should have a broader system thinking approach. So with that, I would like to summarize my presentation as such. If you have any question, please feel free to ask.
Thank you so much, Hyfa, for that wonderful presentation. I really do appreciate. I've also learned a lot during the process. Thanks so much. Yeah, so in case, guys, we have a question, just feel free to share in the chat box, or you can raise your hand. So I'll just start by beginning with a question, Dr. Hiva. So maybe as people prepare and they also digest. I think systems thinking is quite a bit broad, and it requires kind of some practice, continuous practice, that at least you are well acquainted with the whole process. Maybe what will be the penetration areas, or what will be the starting areas that would encourage people who have not had maybe that background? When you're just doing a small project, where would you encourage someone to start off in terms of gaining
That's a
more
great
understanding
question.
thinking?
That's a wonderful question, Daniel. I personally, I am a huge fan of student engagement, actually. When we say student engagement, I would say go deep, like till from the primary school itself. Like when I started with React, you might have observed my first story was about how I wanted to teach them how to make sustainable, how to have their own soap manufacturing. All the schools in the area that we work did have soap and running water, but we made sure that we have small projects there. All these activities that we're talking about is like very small activities. We didn't want to, like, say, community engagement is a very exhausting process. You need a full-time person, you need money to run it. We didn't want to be exhausted. So for me, I personally suggest is like one thing you can start off is like engage school students, try to make changes, like develop a small curriculum from your end and see if they were able to like do a small pre-test and post-test. Like, for example, if they know hand washing practice, or what is it lacking, or probably the schools in the area, if they are having soap or running water, that component alone could be something you can do it. And if they're not having it, try to understand why they're not having it. And there you have a systems approach. Is it because there is no proper fund allocation, or is it because of a particular, like if there is no proper land or a building, or is it because there is no water available? Or is it because the school is not being financially topped up every year by the government? Or is it because we have inefficient faculties present? Or the fund is already being allocated but not being utilized? There are multiple reasons to it. And it's about understanding all these small, subtle things, small, relevant, obviously, but these things wouldn't be something when you look, you're just seeing that the school is not having a gender-specific lateral. Can be multiple reasons. If so, how can we work on it? Can we do a crowdfunding? Does the school provide a provision for it? Can we figure out smaller organizations that can come up and support us? Or can we have individual funders who can provide? Like those things can be done. Another approach I would suggest is like, if there are people from veterinary backgrounds, please, there has been a lot of interest in understanding sustainable farming practices. For example, like one of our activity was like, we conducted a small competition, I would say a competition among postgraduate public health students, like medical or BB public health. So MD residents as well as public health postgraduates or veterinary postgraduate students, where we were trying to develop a set of communications tools that can be utilized on a larger context. So one item or one particular component which the students developed were an application, an Android mobile application, where they summarized all the access components, like access, watch, and reserve antibiotics into one mobile application. So we could easily send it out. So the community that we were working on, there were people who used to buy medicines from pharmacists because the waiting time in the hospitals used to take a lot. These are elderly people who didn't want to wait for longer hours. So they basically went to the medical store and got an antibiotic anytime they have fever. So we tried to teach them how to use this mobile application, and they were like they were utilizing it. In fact, they were like calling up and asking, how do I do? This is the medicine. So these are like small interventions. You can come up with this kind of activities. You can work on the community pharmacies, create a small communication tool and connect with community pharmacies and see the response and how are they doing it, or anything can be done. None of this would require larger effort or activity level. Just that you have to be scientifically and technically right, and you have enough and more materials available. Yeah. So I hope I was able to give some ideas.
Yes, thank you so much, Hyfa, for that. Yeah, it was really informative. Yeah, and I also got a lot. I hope you all learned a lot, even in terms of linking up the interventions with the existing, systems for sustainability and trying to really understand what the problem is. Thank you so much. I think we don't have any other question. I think people are still digesting, but in case you either watch the recording or you have a question afterwards after processing, then I think we'll still share with Dr. Hyfa. So with that, I think because of time, I know it's quite late on your end. So I will just want to release you, Dr. Hyfa, so that at least I know it's around 8:30. But before you go, I really want to thank you for taking us today through the session. It has really been an informative session. I've learned a lot on my end, and I think I will rewatch this webinar happen again several times, so that at least I'm able to also on my end, and also maybe for the participants, so that we're able to understand all these, and I believe this is the way to go, because when we design interventions, it's good we design sustainable interventions that are long lasting, that we don't just do something today and tomorrow it's all faded out. And thank you so much for making your time. Thank you so much for the preparation. You've really done a lot of preparation, and we really do appreciate it. Thank you also for joining in at this late hour. I do appreciate, and I'm sure we've all learned a lot. And in case of any feedback, we'll revert to you. Thank you, and over to you.
Thank you so much, first of all, Daniel, for having me here. It is definitely, I'm definitely happy to share the experiences and the lessons from our project, which has been like at the stage of like dissemination, and I hope to share more details. And if anybody has any question, please feel free to connect over LinkedIn or leave a message or connect via Daniel or whatever is convenient for you. And I hope you guys have a great, mentorship program happening. And thank you so much. Have a great day.
Thank you so much, Dr. Hyfa. I'll be looking through it's really a great project, and we'll also be continuing to see how it proceeds. Thanks so much, everyone, for joining in at this hour. Thank you so much. We really do appreciate, and we'll share the recording and also Dr. Hyfa's LinkedIn links, that at least you're also able to connect with her there. And thank you so much, everyone, and I wish us a wonderful evening. Bye-bye.
Bye. Thank you.